All right, joining us right now is the WHO Special Envoy for COVID-19, Dr. David Nabarro. Dr. Nabarro, thanks so much for speaking to NDTV. My first question to you is, you have seen the reactions of all the countries in the world in the wake of COVID-19. How do you rate India's reaction or response if you compare it to the response of, say, an Italy or the United States?
First of all, I'd like to greet all the viewers and just thank them so much, and thank all the people of India for really taking this seriously. We're actually involved in an epic struggle right across the world in tackling and beating back this virus. It's an enemy. It's a very silent enemy, and it comes into our communities and affects us without us seeing it when it first arrives. And what I'm delighted is that India has reacted quickly as soon as cases of coronavirus have appeared by resolute action to inform people. I just saw Amitabh Bachchan giving an excellent infomercial. So informing the people so they know what's going on, and then getting the whole of the government machinery, the Prime Minister bringing the chief ministers together, so they are dealing with this in a very integrated way. I would ask everybody to recognize that we're all at risk. And if you find particular people and you treat them badly because you believe that they are somehow to blame or somehow involved in spreading, that really doesn't help. It's an enemy that we must all fight together with all the energy we have. I may not have the disease today, but I might well get it tomorrow. I don't want people stigmatizing me or my family. Please stick together. And India has a chance of really getting on top of this virus and getting ahead of it. Other countries were slow when they started. That wasn't any blame to them, it's just a fact. And that was really because they thought, oh, this is not a big problem, there's a few cases, we can wait a bit before we impose strong measures. But in India, you impose the strong measures quite quickly. And although it feels really bad for so many people, the struggle is worthwhile, because otherwise it will build up and it will cause massive, massive disease and completely overwhelm your hospitals. Just look at what's happening in the United States now. Imagine that was happening in India at this time. It would be disastrous. So I'm really asking everybody in India to just continue to work together to fight this common enemy, and not to start picking on each other, not to blame. It's a no regrets action moving forward. It's a struggle like none of us have ever known in our lifetimes before. Thank you.
All right. Now, Dr. Nabarro, a couple of questions related to the state of healthcare. Now, we know, and the Prime Minister also acknowledges that if you look at certain countries like Italy and the United States, who have definitely a better healthcare system, they too are struggling and they have succumbed or crumbled amid the impact of COVID-19. In that backdrop, I want to ask you, there is a lot of speculation on whether masks are required or not, or what should be our first line of defense before reaching the hospital, or before we reach the eventuality of more patients at the hospital.
Let me first dwell on the situation in Europe and the US. The outbreaks that have built up in different parts of these regions are enormous, but they built up because the virus was moving around in communities and action was not taken to isolate people with symptoms early. And if you wait, then it becomes huge. So acting quickly and resolutely is the key. And you can protect health services and health workers all the more if you are quick, as is happening in India. Now, at the moment, we believe that masks should be used primarily by people who've got symptoms to prevent respiratory droplets traveling and infecting other people. And we say either stay at least 2 meters away from other people, or ensure that the infected person has masks to reduce the risk that you get infected if you're looking after them. We also want health workers to be protected. This virus does very easily infect, and health workers are meeting people who might well be secreting large amounts of virus. Health workers are our frontline soldiers in this war, and we must look after them and really treat them with absolute respect. We wouldn't discriminate against them. We mustn't prevent them from having masks and protective equipment. Now, when there are plenty of masks to go round, or if we can make masks in our communities, then it does seem to me a good idea for more and more people to wear masks, because that does reduce risk, and we want to do everything possible to reduce risk. There are going to be, I believe, new types of guidance emerging in different countries, encouraging more widespread use of masks, and also accompanying that with really, really important cough etiquette. Coughing into the crook of your elbow, or if you use some kind of cloth, disposing of that cloth hygienically, and trying wherever possible, if you've got water, to wash your hands frequently and keep washing them. I know it's difficult for people because they don't necessarily have water, but trying to maintain this protection of other people by coughing into the crook of your elbow, trying to wash your hands, and if you've got the capacity to wear a mask, perhaps developing something at home, just anything that can reduce the risk that you are in contact with other people's respiratory secretions. This is good practice. We've all got to get ready in our communities to defend ourselves against this virus.
Now, Dr. Nabarro, India is a huge country with peculiar problems, and obviously the containment of a virus like this will also be a huge challenge. I'm sure you must have seen in the news that we had a migrant exodus problem because you have large populations, many of them stuck because of the lockdown. There was a congregation in various religious spots. What should be the ideal response according to you? Say, for instance, after reading these stories, you were to suggest something to the country. What will you do?
Thank you very much indeed. Number one, remember that this virus is transmitted when people get up close to each other. And you don't necessarily feel very ill yourself, but if you're coughing or if you're sneezing, you can infect somebody else. And as we heard just now, there are tragic occasions where people die. So do please, everybody in your communities, do everything you possibly can to maintain physical distance from other people. And if you've got symptoms of chest problems, please isolate yourself or isolate your family if you're staying close together, and don't be in contact with other people for at least 14 days until the symptoms go away. It's these personal actions that will protect ourselves, our communities, our state and the country. At the same time, please, while the lockdown is underway, build up stronger capacity in communities for detecting people. You won't be able to test everybody. Even in Europe, they've got a problem with testing. So we have to do it on the basis of whether or not we're sick, whether or not we're coughing. And you should basically be highly suspicious with any kind of illness that you feel that is affecting your chest, and get yourself away from other people as soon as you have it. It's for us to beat this pandemic, us as people, through the way we behave and through changing our behavior for a period of time so that we're strong. Once we're strong in our communities, once we've protected our health workers, then gradual release of lockdown can be considered by government, because everybody knows that lockdown is terrible for so many people in society. The poor people get poorer. They suffer because food prices are going up. We know that. They suffer sometimes because of indignities when they're stigmatized by other people. Nobody wants long lockdowns, but you have to put in place a lockdown to get the community services ready, to get everybody prepared for the war that is going to go on for some time.
Dr. Nabarro, it's interesting you spoke about lockdown, because my next question is related to that lockdown. Do you think that India's call for a 21-day lockdown is enough? And on what conditions, if it were to be extended, should it be extended? I mean, what are the markers or the waypoints that we should watch out for?
Thank you for asking this question. Everybody is working out in their different situations, I stress this, what kind of quantitative indicators need to be used when deciding whether or not the lockdown should be released, where it should be released, and how it should be released. the sort of indicators we look at are if somebody has the virus and we interview them, how many people have they been in contact with since their symptoms started? Once a lockdown is in place, the numbers of contacts should be much, much, much less than it would have been previously. And in countries that are checking their lockdowns, they're looking to see whether or not contacts are being reduced. If they are, then that's a good sign. Secondly, what's happening in the hospitals? Are the health workers properly prepared or not? Have we been able to get the protective gear to them, or at least manufacture it locally, even in communities? If yes, that's a good sign. Then you can think of releasing the lockdown. Thirdly, are communities ready? Are there people in the communities, in the health centres, in the sub-centres, in the panchayats, in the districts, who know what they've got to do? Is everybody got their protocols through? It's a big country, but I've seen how in your country, when there's a challenge, you've got fabulous ways to get messages right to the lowest level in the community organisation or the centre of where communities are organised. Has that all happened? Does everybody know what the protocols are? If yes, then you can start thinking about releasing lockdown. Do you know where the virus is really being transmitted intensely? If you do, and I believe you do in India, you've got some idea of where intensity is, then you may decide that those areas need to be in lockdown for longer so that you can be absolutely certain your defences are in place. Other areas you could release it, but be careful, because sometimes virus is being transmitted and you don't know because you just haven't been able to pick it up. So that business of doing it in different geographies needs to be done with great care. Lastly, be ready to reimpose a lockdown if you really have to. Nobody wants to do that because they cause so much pain, distress, suffering and agitation. But you know, this virus is a terrible enemy. It's an unseen enemy, and it really can cause widespread death. We've seen it. You've seen the reports on television or from friends of yours who are in the US or in Italy or in Spain or in the UK. So just recognise that sometimes governments do have to come back with strong action again. But obviously, the government will do everything it can to make sure that in these 21 days they can get the systems in place so that the lockdown can be released. And if it's not released, I tell you, that will be because the problem is still needing efforts to get on top of it. Nobody will continue this lockdown just for the sake of doing it. It's too distressing for everybody. But if it's necessary to continue it, I am absolutely certain this government will do so, because they are really looking very hard at what's going on, and they are following the playbook very, very carefully.
Okay, I mean, that's very encouraging to hear, because the WHO has quite often praised India's efforts as far as COVID-19 is concerned. I also heard in a press conference the WHO saying that this is a country that helped in eradicating polio and smallpox. So we have great expectations.
You know how to do it. India's people know how to do it. And you also know how to deal with food shortages. There are going to be problems in some communities because food prices will go up. We know that happens in this kind of crisis. It's actually a normal thing. And so it's really important to make sure that you're keeping an eye out for if there are places where people are struggling to get the food they need. But India knows how to do that. I mean, we don't offer praise unless we see that there are things being done that we'd like to call out. And in the World Health Organization, we do praise countries that are taking this situation seriously by acting quickly, even when people might ask, is this really the thing to do? The quicker you get onto it, the shorter the pain will be. And I think that that is something that we should really say of the Indian response. Thank you.
Dr. Nabarro, a couple of quick questions before I let you go. Of course, no doctor here in India seems to suggest that these steps are extreme or they should not be taken. Everybody is in agreement that these steps have to be taken. However, they also say don't take this lightly. But there are some doctors, and I spoke to a few over the past few days, and they say that India has a lesser cause of worrying. And they give out 3 reasons. I want to know from you as a special envoy, do you think that this assessment is correct or not? Number 1, universal BCG vaccine may be protective. Number 2, areas with high malaria incidence have been seeing lower numbers. And number 3, the mutation in the COVID strain which has reached India leads to much lesser affinity to bind to the human cells. Can you please explain?
We really do hope that the virus will be much less destructive in India and in other environments where the weather is warm and there are also coexisting infectious diseases that can strengthen and sharpen up the immune system so that this COVID is defeated inside our bodies. Secondly, we hope that processes like BCG immunization will have primed people's immune systems so they can get on top of the COVID. We also hope that the different age structure in many countries that are developing, as we call it, actually India, middle-income countries. So let's say that the age structure in India will be different and that there will be fewer people in the very susceptible age group that seem to have been so hit in Europe. We hope, we hope, we hope. But you can't win a war on hope. And like all medical people, I am really, from the bottom of my heart, hoping that this virus proves to be much less lethal and dangerous in India than it has been anywhere else. But we still have to do the preparations, the actions, the distancing of people through lockdown, and the preparation of communities to be ready, just in case we are wrong. We're all looking to see now whether or not the situation will be milder. If it is, we will breathe such a sigh of relief on behalf of the people of India and other countries that are currently experiencing the early heat of the spring months.
Now, Dr. Nabarro, quick last question. Now, I know that right now the biggest challenge for the WHO is to contain this virus and deal with this invisible enemy. But then obviously you have to investigate about its origins and also this news in the international media which has been spoken about. You can't wish this away. So I'll have to ask you this question. When can we expect a reply? So far, I feel the WHO has not been forthcoming in responding to these questions. You've got US intelligence reports saying that China concealed the extent of the virus outbreak. Do you think these are genuine questions? The world deserves to know the answer.
Yes, of course, the world deserves answers. But you know, whenever I've been involved in outbreaks, especially when they increase exponentially, which means they accelerate super fast, there's always times when you look back and you say to yourself, I wish we had acted earlier. I wish we had acted more robustly. I personally am asking myself, as a public health professional, did I shout loud enough about the need for everybody to get on war footing to deal with this virus weeks ago? I will be asking that question for the rest of my life. And as the history is written, when we've come through this terrible, terrible struggle, everybody will ask questions about whether things were done well enough, whether things were hidden, whether opinions were disregarded when they should have been heeded. I'm not going to do that now. And nobody in WHO should be spending a moment on that now. They are flat out dealing with a global crisis. Then the questions can be asked in due course. Did we do it on time? Did we do it right or wrong? Of course, and we will all take responsibility. People like me are ready to be blamed for any mistakes that we are perceived to have made. But we're not going to get into that now. I'll tell you why. Because all our energy, all our waking hours, all our connections must be focused on defeating this enemy, which is causing such damage in so many parts of the world and such suffering. So yes, of course the questions must be asked. Of course we must be responsible. Of course it's okay to be questioning. But goodness me, let's not waste time on airways. Let's not waste time in international relations on casting aspersions on each other. The only way we will win is by all nations working together with trust, with common purpose. Don't waste time on blaming. I wish I could get that message to world leaders who are taking to the lectern and finding time to cause us to be suspicious of other countries. Not now, not today, not next week, not next month, later. And I know you're going to come back and saying WHO must answer questions. They will do that when the time has come. But we're fighting a war, everybody. We're fighting a war. And you don't all of you know, you don't fight wars by shouting out and slagging off your generals all the time. The generals have to be able to get on and do the fight.
True. True. All right, Dr. Nabarro, thank you so much for speaking to India.
Thank you. Thank you very much.